This is an aid to the gross anatomy practical, oral cavity, soft and hard palate. In this, we'll be talking about the boundaries of the oral cavity, the skeleton of the palate, important mucosal features of the inner pharynx, the tonsillar bed, muscles of the soft palate, the greater palatine canal, the tongue and the sublingual region. The oral cavity extends from the lips anteriorly to the palatoglossal arch posteriorly. The roof is made by the hard palate and the floor by the mylohyoid muscle. The oral cavity can be divided into two parts, the oral vestibule and the oral cavity proper. The oral vestibule is situated between the lips and the cheeks externally, and the teeth and the alveolar arch internally, this part. The oral cavity proper extends from the alveolar arches and the teeth up to the palatoglossal arch here. Here we can see the skeleton of the hard palate, which is made out of three bones, the maxilla and the two palatine bones. I'm sure all of you know that the maxilla is a major facial bone making up most of the anterior surface of the skull. From this view, which is the inferior view of the skull with the mandible removed, shows the palatine process of the maxilla, which contributes to make the hard palate. This is the palatine process of the maxilla. This area which contains the teeth is the alveolar process of the maxilla. Important features of the maxilla to be noted from this view are the incisive fossa here and the median palatine suture. The incisive fossa gives pathway for the nasopalatine nerve and the sphenopalatine arteries. And these are the two palatine bones. From this view, we are able to see the horizontal plates of the two palatine bones. Important features to be noted are the median palatine suture, the posterior nasal spine, the pyramidal process here, the greater palatine foramen here, which gives pathway for the greater palatine nerve and vessels, and the lesser palatine foramen, which gives pathway for the lesser palatine nerve and vessels. Here we can see the same view of the inferior aspect of the skull. Here we can see the maxillary bone, the horizontal plates of the palatine bone, and colored in yellow color is the sphenoid bone. When learning about the attachments of the palatine muscles, it's important to know about some features of the sphenoid bone from this view. This is the medial plate of the pterygoid process. This is the lateral plate of the pterygoid process, and between that is the scaphoid fossa. Here you can see the Eustachian tube, which is also known as the pharyngotympanic tube, and connects the middle ear to the pharynx, which helps to equalize the pressure between the middle ear and the pharynx. Here you can see the mucosa covering the palate. The anterior 2/3 of the palate is made by the hard palate, while the posterior 1/3 is made by the soft palate. When you take the anterior part of the hard palate, the mucosa is thrown into transverse folds called the palatine rugae. These help in making the food bolus. In this part, the mucosa is closely adhered to the periosteum. This prevents the movement of the mucosa with the food. The posterior part of the hard palate, the mucosa is separated from the periosteum. There are many submucosal glands between these two layers. The hard palate is covered by keratinized stratified squamous epithelium. When you take the soft palate, it mainly consists of an aponeurosis, which is acted upon by attached muscles. Much of its bulk is due to mucus and serous glands. It is covered by the non-keratinized stratified squamous epithelium. When the soft palate is elevated, the posterior end comes into contact with the posterior surface of the pharynx. This separates the nasopharynx from the oropharynx and prevents food entering the nasopharynx during swallowing. And in this slide, we can see how the nerves and arteries emerges from the foramina of the hard palate. From the incisive fossa here, you can see how the nasopalatine nerve and the sphenopalatine artery emerge. And from the greater palatine foramen, the greater palatine nerve and the greater palatine artery emerge. And from the lesser palatine foramen arises the lesser palatine nerve and the lesser palatine artery. Then we will be looking at important mucosal features of the inner pharynx, such as torus tubarius, opening of the pharyngotympanic tube, the salpingo-palatine fold, the salpingo-pharyngeal fold, the palatoglossal fold, the palatopharyngeal fold, and the palatine tonsil. This is a sagittal section of the head and upper neck region. Here you can see the nasal cavity, the nasopharynx, the oral cavity, the oropharynx, the larynx, and the laryngopharynx. If you look at the oral cavity, the front margin is made by the lips, the posterior margin by the palatoglossal arch here, the roof by the palate, and the floor by the mylohyoid muscle. If we look at the bone visible in this section, we can see the hard palate made out of the palatine process of the maxilla and the horizontal processes of the palatine bones. Here you can see the mandible, the hyoid, and here the thyroid cartilage. If you look at the muscles in this specimen, here is the genioglossus muscle making up most of the tongue, extending from the mandible to the tongue. Then there's the geniohyoid muscle extending from the mandible to the hyoid bone, and inferior to that is the mylohyoid muscle extending from the mandible to the hyoid bone. Then if we look at the tongue can be divided into two parts, the anterior 2/3 and the posterior 1/3. The anterior 2/3 is situated in the oral cavity, occupying most of its area. It's more horizontal. And the posterior 1/3 is situated in the oropharynx and is more vertical. And then if we look at the important mucosal features, this is the opening of the eustachian tube or the pharyngotympanic tube connecting the middle ear to the pharynx. In the posterior superior aspect, there is a mucosal elevation called the torus tubarius, which is made by the end of the eustachian tube. Anterior to the opening is a mucosal fold called the salpingo-palatine fold. Salpinx means tube in Latin. So extending from the salpinx to the palate is the salpingo-palatine fold. Similarly, posterior to the opening is another fold called the salpingo-pharyngeal fold, extending from the salpinx or tube to the pharynx. This salpingo-palatine fold is a false fold, which means that there is no underlying muscle causing the elevation of the mucosa. But all the other mucosal folds are caused by underlying muscle. This salpingo-pharyngeal fold is made prominent by the salpingo-pharyngeus muscle. And below the palate, there's a fold called palatoglossal arch, which you are already familiar with. It extends from the palate to the tongue. Glossus means tongue in Latin, so this as this extends from the palate to the tongue, it's called the palatoglossal arch. And posteriorly, there's another fold called the palatopharyngeal arch. It's so called because it extends from the palate to the pharynx. The palatoglossal arch is made by the palatoglossus muscle. The palatopharyngeal arch is made by the palatopharyngeus muscle. Between these two arches is the tonsillar bed, and within the tonsillar bed is the palatine tonsil. And if we look at other important features, this is the epiglottis. So the epiglottis moves backwards during swallowing, closing the laryngeal inlet, and prevents food entering the larynx and the airway during swallowing. And the space between the posterior aspect of the tongue and the epiglottis is the vallecula. So this area is called the vallecula. Food particles such as fish bone may get lodged in there and cause discomfort, and if it's lodged there for a long time, may cause even infections. Here the mucosa has been removed, showing the underlying muscle. Here we can see the salpingopharyngeus muscle, which underlies the salpingopharyngeal fold. Here the palatoglossus muscle, which underlies the palatoglossal fold. Here the palatopharyngeus muscle, which underlies the palatopharyngeal fold. This slide shows the tonsillar bed. We have already seen the tonsillar bed between the palatoglossal fold anteriorly and the palatopharyngeal fold posteriorly. If we look at the coronal section of the pharynx, here we can see the palatine tonsil, and lateral to the palatine tonsil is the superior pharyngeal constrictor. An important anatomical point to be noted is that the glossopharyngeal nerve is related to the tonsillar bed. Here you can see the palatoglossal arch, the palatopharyngeal arch, and the tonsillar bed. Here you can see the glossopharyngeal nerve. In conditions such as chronic tonsillitis and paratonsillar abscess, the tonsil may have to be removed. And in those situations, you have to be careful not to damage the glossopharyngeal nerve. Next, we'll be looking at the muscles of the soft palate. There are 5 pairs of muscles involved in the soft palate, which are palatoglossus, palatopharyngeus, tensor veli palatini, levator veli palatini, and musculus uvuli. In this diagram, you can see the palatoglossus muscle and the palatopharyngeus muscle. The palatoglossal muscle extends from the palate to the lateral aspect of the tongue. The palatopharyngeus muscle also originates from the soft palate and extends into the pharynx. Here you can see the insertion of the palatopharyngeus muscle. It inserts into the lateral wall of the pharynx. Some of its fibers insert onto the thyroid cartilage. In this diagram, you can see the palatopharyngeus muscle extending from the soft palate to the pharynx, as well as the levator veli palatini muscle here and the tensor veli palatini muscle here. In this diagram, you can see the tensor veli palatini, levator veli palatini, and the musculus uvuli muscle. The tensor veli palatini muscle originates from the scaphoid fossa between the medial and lateral pterygoid plates of the sphenoid bone, the lateral aspect of the eustachian tube, and the spine of the sphenoid from this area, and inserts into the palate. So then the levator veli palatini originates from the apex of the petrous part of the temporal bone and the medial aspect of the eustachian tube, and inserts into the palatine aponeurosis. The musculus uvuli is 2 slips of muscle extending from the palatine aponeurosis into the connective tissue of the uvula, which can be seen here. So the 5 pairs of muscles of the soft palate are involved in making speech. and pronunciation, and also in closing the nasopharynx during swallowing and prevent regurgitation of food into the nasal cavity during swallowing. So all the muscles of the soft palate are innervated by the vagus nerve via the pharyngeal plexus, except for the tensor veli palatini muscle, which is innervated by the trigeminal nerve. The Greater Palatine Canal extends from the sphenopalatine foramen into the Greater Palatine foramen. We already know about the Greater Palatine foramen. The sphenopalatine foramen is situated posterior to the middle concha of the lateral wall of the nasal wall. Here we can see the sphenopalatine foramen. The Greater Palatine Canal gives passage for the Greater Palatine nerve, the Lesser Palatine nerve, and the descending palatine artery. The tongue is mainly a mass of skeletal muscle covered by mucous membrane. It is separated at the midline by a fibrous septum, which can be seen here. The tongue can be divided into anterior 2/3 and posterior 1/3. The anterior part is also known as the oral part, as it is situated in the oral cavity, and the posterior 1/3 is also called the pharyngeal part, as it is situated in the oropharynx. Between these two parts, there's a small groove called the sulcus terminalis. Here. At the apex of this sulcus is a small depression called the foramen cecum. It is important to know in the embryological origin of the thyroid gland. The anterior 2/3 of the tongue contains 3 types of papillae. Filiform papillae, which gives the velvety appearance of the tongue, and fungiform papillae, situated more towards the edges, and valate papillae, situated just anterior to the sulcus terminalis. And on the posterior part of the tongue, there are foliate papillae, situated on the lateral aspect of the tongue. The posterior 1/3 contains mucus and serous glands and aggregations of lymphoid follicles, which together are known as the lingual tonsils. Muscles of the tongue can be divided into intrinsic and extrinsic groups. The intrinsic muscles are within the tongue and not attached to bone. Extrinsic muscles have a bony attachment. There are 4 muscles in each group in each half of the tongue. The muscles of the intrinsic group are superior longitudinal, inferior longitudinal, vertical, and transverse. The intrinsic muscles of the tongue act to alter the shape of the tongue. In this diagram, we can see the 4 extrinsic muscles of the tongue: the palatoglossus, styloglossus, hyoglossus, and the genioglossus. We already know about the palatoglossus muscle, extending from the palate to the side of the tongue. The styloglossus extends from the styloid process here to the side of the tongue. This is the styloglossus. The hyoglossus extends from the greater horn and the lateral part of the body of the hyoid bone and extends upward in a quadrilateral sheet to insert to the side of the tongue. The genioglossus extends from the superior mental spine of the mandible here and radiate backwards in a fan shape to insert to the mucous membrane of the tongue. The extrinsic muscles of the tongue act to alter the shape as well as the position of the tongue. The sublingual region is below the tongue and can be seen when the tip of the tongue is raised to the roof of the mouth. The features that can be seen are the frenulum, which is a midline septum of mucous membrane which unites the inferior aspect of the tongue to the floor of the mouth. Lateral to that, we can see the deep lingual veins through the mucosa. Then we can see the sublingual fold, which is the prominence of the mucous membrane which overlies the sublingual glands. Then we can see the sublingual caruncle, where the submandibular ducts open. This is a sagittal section showing the sublingual region. This is the hard palate, soft palate, the vestibule of the mouth, the tongue, the genioglossus muscle, the geniohyoid muscle, the mylohyoid muscle. This is the hyoid bone. This is the lingual artery with the deep lingual branch and the sublingual branch. This is the lingual nerve. This is the hypoglossal nerve, the submandibular duct, the submandibular duct opening. This is the sublingual gland. Here is the epiglottis, the vallecula, the oropharynx. This slide identifies the areas numbered in the above slide. Usually a normal adult has 32 teeth, 8 in every half of upper and lower jaw. The teeth are situated in the alveolar processes of the maxilla and the mandible. From the midline outward, the teeth are 2 incisors, 1 canine, 2 premolars, and 3 molars. When an adult loses a tooth, the alveolar process of that area degenerates and new bone fills the socket, resulting in a smooth surface. In this specimen, all the teeth have been lost before death. This is called a edentulous mandible. In this specimen, the teeth have been preserved, and in this specimen, the teeth are lost after death. Thank you.